In this brief video, we illustrate our protocol for 3D ultrasound assessment during the one-visit infertility workup. We present a case report of a 37-year-old woman, gravida 1, para 1, who presented with secondary infertility for 1 year and a history of 2 failed IVF cycles. After an initial telemedicine consultation during which we obtained all the relevant information of the medical history, we scheduled a clinic visit on day 7 of cycle to perform a 3D ultrasound assessment of the uterus, a 3D antral follicle count, and a sonohysterogram to evaluate the uterine cavity and tubes. On the same day, we also performed a semen analysis and routine blood tests. This slide illustrates the acquisition of a uterine volume, and as you can see, it's a very quick procedure. After the patient leaves the ultrasound room, we take measurements on the sagittal plane and assess myometrium and endometrium. We then reconstruct the coronal plane, assess the uterine shape, and in this case, rule out the presence of uterine malformations. This slide shows the acquisition of an ovarian volume. Again, after the patient has left, we proceed to count follicles on the 3D volume using the SonoAVC antral tool. After the 3D ultrasound is completed, we proceed to performing a mock transfer, and with the same catheter we inject saline solution to distend the uterine cavity and finally acquire a volume of the uterus. We reconstruct the sagittal plane and assess the endometrium. We then reconstruct the coronal plane and assess the uterine shape. Finally, using a mixture of saline solution and air obtained by shaking a 20 cc syringe, we move on to evaluation of the tubes. We acquire a volume of the tubes during the injection and then reconstruct the images. This is a rendered image of the right fallopian tube showing moderate hydrosalpinx with a patent tube. After discussing these findings with the patient, we scheduled a laparoscopy, which confirmed the findings of bilateral hydrosalpinx and performed a bilateral salpingectomy. Based on the findings at sonohysterography that showed a polypoid endometrium and intrauterine adhesions, we suspected a chronic endometritis and prescribed a 2-week course of antibiotics. Hysteroscopy was performed 1 week after completion of antibiotic treatment and showed persistent chronic endometritis, which was confirmed by pathology. After completion of a second course of antibiotics, an endometrial biopsy showed absence of endometritis. In conclusion, this case represents a good example of how 3D ultrasound during the first infertility visit allows optimization of the diagnostic process, expedites care, and enhances patient experience. 3D ultrasound technology allows, as you have seen, for the acquisition of a volume that can then be processed to obtain images in all planes as precise as CT scan or MRI. This is of paramount importance to make the correct diagnosis and plan treatment in preparation for assisted reproduction. 3D sonohistograms and automation tools such as SonoVC antral and SonoVC follicle enable a more precise diagnosis, treatment, and monitoring.
(3D) Uterine trace displays the coronal plane of the uterus with minimal effort. Simply trace the endometrium on the screen. The acquisition starts automatically. Direct link to uterine classification allows for easy documentation of uterine shape. The Voluson Swift is feature-rich to support diagnostic confidence in a fully customizable system. This is the Voluson Swift, and this changes everything.